I want to speak briefly on the 10 rights of medication administration. So, whenever I went through paramedic school several years ago, we only had 6 rights, and now they've upped it to 10 rights. And I think it is pretty important to have those extra 4 rights in there that we have at the end here. So, first off, we want to make sure we have the right patient that we're giving the medication to. It's not usually a big deal in EMS because we typically only treat one patient at a time. But if you are working in like an ER setting or something like that, it's always important to verify that you are giving it to the right patient. Make sure you're giving the right medication, checking that there's a lot of different medications out there with a lot of different similar names, and it's easy to mix them up. Atropine and adenosine are probably the most common ones that I see that they kind of get mixed up. Thankfully, that gets caught before it's actually given to a patient, but there's that risk of messing up between the two similar names. The right dose. Be familiar with all the different doses that you need to know. Difference between epinephrine for cardiac arrest and anaphylaxis, all those different things. Also be proficient with your medical math and knowing how to calculate that based on what different concentrations you might be carrying on the truck that day or in the ER or whatever. The right route. There's lots of different routes to give medications, IV versus IM, or giving it orally, all those different things. So be familiar with that and what you need to be giving. The time, right time, knowing whether to push a rapid, say IV push or a slow IV push. There's not too many medications that we do via rapid IV push. Adenosine is kind of the main one. Most medications that we give are going to be a slow push, but knowing that right time and also repeat dosing. If you need to give another medication every 5 minutes or repeat the dose every 5 minutes or something like that. Having that time in mind, and also what time you give the medication, because they're going to want to know that at the hospital. And that kind of brings us to the next thing, is the right documentation and reporting. Be sure to tell the receiving staff what you gave, what time you gave it, and what effect it had on the patient. If you gave albuterol, it's been half hour ago now, but it made their breathing a whole lot better. You need to pass along all that stuff and also write it down in your patient care report. Be sure you're doing the right assessment, a very thorough assessment, and that will help narrow down what medications you need to be giving based on your assessment findings. It also helps rule out, different contraindications and indications for different medications. So make sure you're very good with your assessment. That was one reason that Oklahoma got rid of LASIK several years ago. There's a lot of issue of providing a good or performing a good assessment and knowing the difference between CHF and pneumonia. They both have maybe some breathing difficulty. Well, LASIK, you give for CHF, but you might not give it, or you don't give it for pneumonia. And being able to perform a good, thorough assessment, there was some issues with that. And that's one of many reasons, but just played into why they don't carry LASIKs on the truck very often around Oklahoma anymore. Patient education. Be sure you're talking to the patient. Let them know what the medication is going to do to them. Let them know how it's going to make them feel, all that stuff. Lately, there's been a big push for fentanyl and a lot of fentanyl abuse in the United States lately. And I've actually had several patients refuse fentanyl because of the stuff they see on TV, the news reports, stuff like that, and just educating the patient that, taking fentanyl one time isn't going to make him an addict, but just informing them and educating them as you go. And also, keep in mind that the patient does have the right to refuse. If they don't want a certain medication, that's their right, as long as they're of sound mind. Get that signature showing that they're refusing the treatment, write it all down, document it real well, but know that they do have that right to refuse. And then after the medication is given, make sure you're doing the right evaluation. Reassess the patient, look for those desired effects, look for any adverse effects or side effects that you might have with it. And then also keep in mind that you might have to give them another dose of it, after a few minutes. Fentanyl was a big one, it only lasts about 15 minutes or so you might have to give them repeat dosing. That pain might start coming back and getting worse. So just keep that in mind. These are the 10 rights of medication administration. They are very, very important that we know those, have them all memorized, and practice them on a regular basis.